ahead and go live. Okay, we're all set. Go ahead.
All right, perfect. Thank you so much, Dana.
You're
So
welcome.
it is Thursday, June 27th at 1:30, and we will call the Greater Boroughs Advisory meeting to order. If we could do a roll call. So Boylston.
Sarah Barrett, Board of Health, Boylston.
Southborough.
Chelsea Malinowski, present.
Northborough, Isabella, present, and Jen from Westborough isn't here yet, but we will add her once she does. So we do have quorum, so thank you all to the attendees and the panelists for joining us. Today we have Amanda Decker, who is presenting. Her organization is Bright Solutions. We, as the Greater Boroughs Partnership for Health, contracted with 3 amazing consultants to do this opioid strategic assessment. Amanda will really dive into what that, entailed, but we really wanted to use some grant money to inform how we use our opioid abatement funds. And this was a regional effort for Boylston, Northborough, Southborough, and Westborough. So without further ado, Amanda, I will let you take it away. Thank you so much.
Hi, good afternoon, everyone. I am excited to dive into the findings from your report, but I just wanted to share a little bit about myself first. So I have been involved in substance use prevention work with communities since 2001, believe it or not. And my specialty is really helping communities get data and then develop and create strategic plans to reduce and prevent substance use across the Commonwealth. So I'm very excited to be here today, and I appreciate the commitment of everybody on this call to this work. And I, without further ado, I'm just going to jump in and get started. So the first thing I just wanted to go through was kind of the background. As Isabella just said, the Partnership for Health commissioned an assessment on substance use as part of a strategic plan to use municipal abatement funds effectively. And so this is pretty common across the state right now, that communities are really trying to figure out what's happening in their community, get some input from community members before designing a plan to use those dollars. And so the objectives, this assessment was aimed to gather that data to inform the expansion and strengthening of prevention, harm reduction, treatment, recovery services in the community, really find out what that looked like for all of you. There were some limitations, however, as with all assessment and collection. The qualitative data and interviews might not represent the entire community, so we did have some youth survey data lacking in the community of Boylston. And then we had some sectors that were underrepresented in key informant interviews. So this is a start, and more data will continue to be collected. But as just a general rule of thumb, sectors that information was collected from is what we would call the 12 sector representatives that are often used in coalition world, or what we would call drug-free communities. And those tend to be youth, parents, law enforcement, media, schools, local businesses, health organizations, organizations working with young people, the media, and just kind of looking into the different groups of people, as well as people with lived experience. So there is a number of different folks that had been listed as key informant interviews, and you can find that in the entire report, which we will have a link, I believe, at the end of this for you to dive in deeper if you wanted to know exactly who was communicated with. So this is just in a nutshell the executive summary, and we'll dive deeper into each of these topics. So across the board, alcohol was the most commonly used substance among young people, with vaping being the second most used. But on a positive note, across the board, substance use has decreased since 2018 for most substances. So that's great news for communities, that we are seeing a trend in the right direction of youth use going down. And that's common actually across the state as a whole. Deaths related to substances, substance-related deaths varied by community, with opioid-related deaths being a significant concern. And I'll dive deeper into exactly those slides for you. Crime. So substance use, as we know, is linked to increased crime rates, including drug violations and DUI incidences. Community members were expressing concern over the rise in such crimes. And then hospital visits. So of note, Boylston had the highest age-adjusted rates for substance-related ER visits. And these trends indicate a general visit and ER rates for substance use over recent years. And there's a lot of discussion around what does that exactly mean, with are more people going to seek help as opposed to the past, or are more people in need help? So more information needs to be collected around that long term. Now we're going to kind of dive into each of these kind of bullet points. So we're going to talk a little bit too about what services at the end your community does have. So there were a number of different services in your communities to address and prevent and reduce substance use. But there were some gaps, and we'll talk a little bit more about that. And then as far as the community needs, a summary in general is the community is requesting more mental health support, earlier education when it comes to substance use, and better outreach as critical needs. And some of their concerns in the community included bullying, the impact that social media is having on substance use, and then a lack of supervision or programming available to supervise youth. So now we're going to jump into kind of what does this information all mean. So we collect something called the Youth Risk and Behavior Survey, or for all of you, the Metro West Adolescent Health Survey. So this information is collected across many different communities in the Metro West area. And for all of you, this is kind of what we had and put together. But you can see the lifetime use rates in the yellow. That alcohol is still of a major concern when it comes to substance use among youth. And then vaping is a close second. And these are what we would call current youth use rates. So when we explain current use, we're talking about youth who's used a substance in the last 30 days. And so again, you can see that alcohol would be the main concern. This is in your middle schools. And then looking at high schools, again, same, alcohol is of the most concern, with a close of electronic vapor product. Doesn't mean that any of the other substances are not of interest or important. It's just these are the most common use. And that is consistent across the state as well, as alcohol, tobacco, and marijuana tend to be the most used substances. We also looked into adult substance use as well. And I think this is of note because the US rates of adults 18 plus binge drinking in the last 30 days for the United States was 15.5%. And as you can see across your communities, you have a higher rate of binge drinking. And then looking at cigarette use in a lifetime, you can see in the state, it's actually higher. So the good news is what is happening in communities in your area to decrease smoking rates seems to be on a positive trend. Looking at deaths related to substance use. So this is any substance-related overdose deaths you can see across the spectrum, and we'll dive into a little bit more about what these mean. But as you can see, just looking over the years, there's been an uptick when it comes. Yes, Jennifer, you had a question. Sure.
Hi, sorry. So Westboro, I know numbers are skewed because of the rehab we have in town.
Mm-hmm.
So is that part of that number?
Yes, and you can look through, like when I send you all like the entire report, you can kind of look through as like how that was factored out. But as far as like overdose deaths that are reported, these are just the ones that are reported specifically happening in your town in general.
So Spectrum's not part of that? Because Spectrum's in our town.
Let me find out that for you, Jennifer, before we jump off the end of this call. I'll make sure that I answer that question because I want to.
This concerns me to be out there if it's different, because I know because they're not residents of our town.
Correct.
All right, thank you.
Right. Yeah, and I will definitely find out that and make sure. So just her question was Spectrum represented in the numbers for overdose deaths, and we're going to make sure that we answer that for you. Okay, so then the next piece was that we looked at was crime related to substance use. So Westboro had the highest drug arrests, most were for possession and concealing, and then Northborough and Southborough led in DUI arrests, especially in the ages 35 to 54 group. The most frequently seized drug were narcotics, followed by stimulants and other drugs. When police were interviewed and enforcement was interviewed in communities, they linked the majority of calls to substance misuse. Also, shoplifting was a concern. And then thinking about substance use in general, it increases crime, family disruptions, and burdens EMS services. And we all know that to be true. Lastly looked at were those hospital visits related to substance use and substance-related ER visit rates. Boylston had the higher age-adjusted rate for any substance-related and alcohol-related ER visits compared to other communities in the coalition in Worcester County. And then some trends that were happening is that Boylston saw a drastic increase in age-adjusted ER visits for any substance, more than doubling in just 1 year. And again, the reasons behind that we are not quite sure of yet. So it could be that more people are seeking treatment or that there's more of an issue. And then trends in ER visits for alcohol. So Westboro has historically had the highest number of ER visits for any substance. And then rates have doubled in Westboro. And again, Jennifer, what you were just saying, if people are accessing more treatment, that would make sense. So looking at those ER rates, you can see Boylston had a drastic increase for ER rates for any substance over time. And then looking at the number of visits related to alcohol trends, this slide reflects that. I want to shift gears now just to talk a little bit about some of the things that are happening and educate the group just a little around what's happening to address some of these issues, and then talk about some of the particular reasons why we're seeing substance use happen in our communities. So the first thing I wanted to bring up is what we call in the prevention field the continuum of care. So when we talk about addressing, reducing, and preventing substance use across the whole, there's a wide spectrum of what that looks like. So the first, when we think about that, is we think about health promotion in general. So that's messaging that you see across the community in general to promote health, and thinking about best practices and healthy things across the board. And that spectrum goes all the way from promotion all the way to people in recovery as well. Next, we think of the prevention field. So some of you think of things like universal prevention. So that would be all the way back to washing your hands is universal prevention. The next would be selective prevention. So thinking of different group populations that might need a more of a focus. And then indicated prevention, that's literally addressing or targeting a specific, very narrow set group of people. We move into treatment, which should be part of your overall plan. And people are pretty familiar with what different treatment things look like in general. But talking about some of the relapse prevention treatment that's been popping up that's newer, we'll get into that a little bit more as we continue to talk. And then recovery services. So community that is doing best would have a wide menu of all of these different services available in their community. I wanted to talk a little bit about, starting at the beginning though, what primary prevention is and how does that work in a community. So I'm going to just ask if you bear with me to watch this quick clip about what that is.
All of us want to keep our kids and communities safe and healthy. An important step is to learn about preventing substance use disorders and to understand that the adolescent brain is more vulnerable to alcohol.
Getting feedback, you might not see my screen, so I'm just going to try that one more time. Okay, let me know if people can see that now.
Hi, Amanda. YouTube legally won't let you broadcast stuff that's on there, so it won't work. I'm sorry.
No worries.
Yeah.
I'll just explain what was on the great little clip that I was about to share. So this, I'll add that to the end of our presentation, if that'd be helpful for people, if they want to go back and watch this little piece. But really what it explains is that, let me just show you the screen. So it explains that with primary prevention, it's really about stopping use before it starts. And oftentimes in a community, people will tell me that they're really concerned about overdose deaths, but thinking about what happens before people ever start using. And the truth is that 90% of all addiction begins before somebody's brain is developed, before the age of 21, 90%. When interviewed in your communities, when persons who have lived experience were interviewed, they were asked about when they started first using substances, and the majority of the time people would say as a young person. And so one of the things that John Knight, who is the founder and director for the Center for Adolescent Substance Addiction Research at Boston Children's Hospital, likes to say is that addiction is primarily a pediatric disease. And that's why it's so important for communities when they're thinking of strategies. You definitely want to have things in place to address people who are currently using and are in recovery, but you also want to make sure that you include prevention because, again, as John Knight said, it's primarily a pediatric disease, and 90% of people who use a substance began before their brain was developed, before age 21. So additional definitions of prevention, after we talk about primary prevention, we have what we call secondary prevention and tertiary prevention. So secondary prevention really are programs that address individuals who already started using substances. So thinking of places like a detox or rehabilitation centers, as well as places that offer things like harm reduction. And I'll talk a little bit about what harm reduction is and what that looks like for opioid prevention, overdose prevention centers. And lastly is tertiary prevention. So they're sometimes referred to as reuse prevention. So that form of prevention really aims at making the individual drug-free therapy by minimizing problems associated with its use. Just talking a little bit about harm reduction, because there's a lot of debate about what does that look like. So an example of harm reduction includes overdose prevention centers, and it's an evidence-based, practical, transformative approach that incorporates public health strategies, including prevention, risk reduction, and health promotion to empower people who use drugs and their families with the choice to live healthier, self-directed, and purpose-filled lives. So it really centers lived and living experience of persons with substance use disorder, persons who use drugs, especially those in underserved communities. And the reason I wanted to bring this up is oftentimes people will perpetuate the myth that places that are harm reduction are just enabling people to use more substances. But the truth is that by the time somebody gets to a place where they're using harm reduction strategies, they already have an addiction disorder in place, and they're really seeking out assistance. So people will often say that they're trying to get a safe place to get high, and that's actually not true. When addiction, a person who has a substance use disorder has addiction, they're actually not at the place anymore where they're able to use a substance to get what we would know as a public like that high. They're actually using so that they don't get sick. And people traditionally don't go to overdose prevention centers just thinking about how much work it is to get to a center because they want to just use. They're using because they actually don't, that one, they want to live, and two, they're more open to getting some assistance and treatment. And there's some great data that we included that you can read more about what harm reduction looks like and some of the successes in actually getting people assistance and getting people treatment because of places like such. And so now I want to talk a little bit about what are some of the factors contributing to use or non-use in your community. So we call these risk factors and protective factors. Risk factors are just simply something that would be in place in your community that would be associated with a higher likelihood of a negative outcome. And same with protective factors. So it would be something in your community that would make it less likely that people would use substances. And so there was a lot of data collected around what are the risk factors happening in your communities, as well as what's working in your communities and seen as a protective factor. So one of the first risk factors that came up significantly was the fact that you have a high increase of access to substances in your communities. So almost half of young people believed it was very easy to access electronic vapor product. And when young people were asked where people were getting these products from, they would say older siblings, friends, and social media. And use often would occur in bathrooms or in cars. When thinking of access to alcohol in your communities, most young people were saying alcohol was accessed from friends and family. High school students were getting it at parties, while middle schoolers were often accessing it at home with the knowledge from their parents. When it came to marijuana, approximately 45% of high school students reported that it was easy to access marijuana. And again, sources included those older siblings, friends, and social media. Usage was often occurring in cars and through edibles. And then thinking of access to substances, parents and community members were saying that they believe adults might be providing substances because they're thinking that it's safer for youth to use at home. There's kind of that attitude that if you take the keys away, it's okay for youth to engage in these behaviors. When we know, in fact, that most of the incidences that occur when it comes to things like alcohol don't have to do necessarily anymore with drinking and driving, but there's a whole bunch of other alcohol-related incidences that contribute to danger, such as, choking, drowning, or using too much. So that whole attitude of just taking away the keys isn't a great solution, but it's the normalization of substance use with people in the community saying, oh, that's just what young people are going to do. Digging more into those perceptions, 73% of parents are concerned, though, about youth substance use. 65% of parents believe that most high school students in town are using alcohol, but only 10% believe their own child use. And this is a really big discrepancy. So thinking that everybody else is doing it, but not my child. And then most parents, over 90%, are thinking there's significant use or risk for their children using substances, but less so for vapes. So there's a really discrepancy between how dangerous it is for young people to use vapes. Then thinking about what youth perceive. So when youth were interviewed, they see substances as a coping mechanism for mental health, stress, or anxiety. And students report using vapes due to peer pressure and the perception that it's healthier or safer than cigarette use. Youth believe that their parents would disapprove of substance use, but they think that their peers are more accepting, especially regarding marijuana. And a quote from a key stakeholder interviewing said, "You have to look at the silent kids. Kids who are struggling with mental illness, they will self-medicate. They aren't addressed enough and they aren't getting into trouble, so they aren't noticed." Next, we looked at community norms as a risk factor. So most community members were reporting casual and rite of passage attitudes towards substances. So again, that idea that it's just going to happen is what young people do. Parents often believe that substance use is a normal part of growing up, leading to a not my child type of mentality. And this results in parents thinking that substance use is more common among other children, but not necessarily their own. And a key stakeholder said, as far as the data, we're seeing double the use of rape from 9th grade to 10th grade. If any other disease doubled, we'd be all over it. The next we looked at was community norms. And that's some of the issues there were adults' behaviors modeling substance use as a way to relax. So you'd hear people in the community saying things like, I can't wait to get home and just, drink as a way to calm down and relax. And then thinking of stigma and judgment toward those who are struggling with addiction that still persists, or the perception that addiction is a choice rather than a disease. And that's really important when you're thinking of people who are seeking help. So having that stigma in the community makes it less likely that people would go and access treatment and help. And there's also a disconnect between those who have been directly impacted by substance use and addiction and those who've not. And the key stakeholder interview, one of the quotes said, they typically start using substances as an escape to get relief. They end up putting themselves in dangerous conditions and their feelings are exacerbated. Now talking a little bit what some of the protective factors or the resources are available. So in your communities, some of the protective factors and the resources that are available. So Massachusetts does provide numerous resources like peer recovery centers, Narcan distribution, and fentanyl test kits. And I know your communities do have some of those programs in place. Another resource is that school programs include something called the Interface referral system. So it's a system where people in communities can call and get somebody to walk them through connecting them with services rather than the individual getting on a whole bunch of calls, waiting for people to call them back. They have a system in place through the interface where somebody can walk a person in your community through getting assistance and match them with assistance and treatment help. Rather than the person having to keep, making all those phone calls. So it really breaks down that barrier, makes it easier for people to access treatment. Something called the I Decide program. So that's a program that many schools have piloted that would intervene when a young person is caught using substances, that rather than get suspension or something like that and have to stay home, they get in-school treatment and help assistance to learn, how to redirect that rather than a punitive approach. So it's more of a therapeutic, restorative approach instead of a punitive approach. And then school resource officers have been a big help as well, knowing how to connect young people to systems and help. Some of the barriers, though, for your community across the whole included stigma. So still that idea that, not in our communities, we don't want to see it, we don't want to know about it. A fear of retribution. Some of the community members talked about, like, if they did get assistance or admit there was an issue or a problem, the way that they'd be looked at from the community, and some of the lack of knowledge about available resources. So when people are asked, would they know how to get treatment or how to access help, there's a lot of confusion around what would that look like. So some additional barriers were logistical issues. So community members said that, they might know that there's help available, but getting to those places where there's help, there's a lack of transportation. Community members also mentioned affordable housing and then high cost for treatment as well. Some of the services that were available that were mentioned in the assessment, so were community-based treatment programs. So programs such as Spectrum, AdCare, Westboro Behavioral Health, Aware, North Star Recovery, and Advocates in Framingham. And these different programs offer various levels of care from outpatient to residential services. Addiction services included school resources. So again, like we mentioned, Interface or I Decide. Different schools were doing lecture series and community presentations, as well as school resource officers to support students in need of substance use treatment. And then we're judicial and police programs. So programs such as a jail diversion program in Section 35, along with police and fire department initiatives that could help individuals access treatment rather than face incarceration. Some of the gaps, again, as I mentioned, were concerns about lack of affordable housing and sober living options, limited oversight of treatment centers, and insufficient long-term treatment coverage by insurance. Additional efforts from some of these discussions to address substance use and misuse. So Northborough and Southborough has a community naloxone program. There's also monthly trainings available for anybody in the community on Narcan. And Narcan is the drug that's used to reverse an overdose. So there's trainings around what is Narcan and how to properly use that available to anyone in the community. And then many of your communities have what we would call community coalitions. And so that's a group of people, the different sectors in the community that meet on a really a regular basis to help develop and create programs to address substance use. I know that in Northborough and Southborough, their coalition Encompass also has a drug-free community grant which is a federal grant in the amount of $125,000 a year for 5 consecutive years, renewable for up to 10 years, to address reducing and preventing youth substance use. And that drug-free communities grant is available to any community to apply to do. And so that resource is available. And then also there's fentanyl test strips available as well that are free to communities again. And I just wanted to share a little bit of a word about education. So we're going to move in a few moments to some of the recommendations and then just have a discussion for any questions that you might have. But I noticed in your report, a lot of community members were saying that there just needs to be more education when it comes to using substances. And I know some of the people on this call might remember this campaign, that This Is Your Brain on Drugs campaign. We call these in our community scare tactics. So the goal is to show young people or people in your community the scariest thing possible and scare the health into young people. And actually, believe it or not, young people will often tell us that this is a great solution for them as well. They'll say, just tell us the scariest thing that you can, and then we'll stop using substances. And we see this in what we would call like mock car crashes. So some communities will put, a crash car on a school property and tell all the kids that. But long term, there's been a really incredible study done of these scare tactics. They don't work long term for developing brains. So young people whose brains are still being developed will often see messaging like this. They'll get really excited about it. But the actual effect it has on use is little to none. And even in some areas, it's increased use, because youth will say, that's terrible, that's horrible, but that's not going to happen to me. And so something that works better when it comes to education is, in many communities, youth will say the number one thing that is affecting their use or non-use is peer pressure. They would say that if they were in a room where a lot of young people are using substances, they'd be more likely to use. Or even better, if they believe most young people use substances, that has a direct effect on what they do. So if they think everybody is doing it, they're more likely to say, I might try that myself. The exact opposite, though, has an effect as well. So for young people, positive peer pressure has been shown to be one of the #1 education efforts that does work in communities. So letting young people know, for instance, in every single one of your communities, the norm is not to use substances. But parents, adults, and youth themselves don't believe that. And so changing that narrative and letting young people know the norm is non-use, and it's okay to not use substances, and making it, okay to say that I don't want to use, actually has an effect on use as a whole. So if young people grow up in a community believing that it's okay to not use substances, believing that most of their peers don't, they actually end up not using as much as communities who believe everybody does it. And I can answer more questions about that as well. It's often called like a social norms approach or social norms theory. So, in talking with those suggestions for future strategies, overwhelmingly, the community said we need an increase in that peer education programs in schools to leverage youth influence and trust. We would like to see an implementation of coping skills, training, and substance use education starting in middle school. So when young people were identified as having struggles with mental health or ways to go ahead and cope, having those skills in place would change the trajectory of actual use. The community was saying they would love to see parent-focused seminars on discussing substance use and its impact with children. So the community didn't feel like parents knew how to have those discussions, what to say and what not to say. Suggestions also included expanding access to quality treatment options regardless of insurance costs, coverage. So it didn't matter what insurance you had, there'd still be a treatment option that was quality for you. Enhancing public awareness campaigns to correct those misperceptions about vaping and marijuana. And so thinking that either vaping or marijuana were, safe drugs for youth to use. They're changing that perception that no use is safe for undeveloped brains. And then increasing support for harm reduction programs and providing the education about their benefits. So helping people to understand that having harm reduction programs in place in a community did not mean that you were encouraging use, but really, the reality is that people who use those programs are more likely to get treatment and assistance. Additional suggestions for future strategies were that every community represented on this call would have a funded prevention coalition in their community. So seeing, what the communities of Northborough and Southborough were able to do and obtain funding, that would happen in all the different communities. And then thinking long term that there would be sustainability once that funding ends, that the prevention work in a community would not stop, that would really continue. And that there be ways to sustain that. Additional community needs and concerns that came up were bullying and cyberbullying, social media and advertising influence substance use. So community members were talking about how in many of your communities, young people will see on social media advertising and things for substances, but also there's other places in communities. So thinking of like package stores or places like that that have advertising and how that affects young people. Lack of adult supervision affects youth behavior. So thinking of there are programs that are available in your communities for youth to use, but helping people to understand what those adult supervised places are and how to access them by young people. And then mental health issues like isolation and the lack of socialization. Some of the resource gaps and suggestions was the need for more mental health services for youth, better outreach in your communities and awareness of the available resources, improved communication strategies that could reach all groups. So thinking of different groups that might be left behind. So making sure that whenever communication strategies were created, that you're reaching all aspects of the community. And then support for grassroots organizations and workers. I wanted to do a stop share now though, and just answer any questions or if you wanted to talk more. And I do know, Jennifer, I'm still looking into that question. And I'm hoping by the end of this call that the evaluator will be able to text me and just let me know if that included your treatment center. But I wanted to put up for any more questions. Or just something that stood out that you wanted more information about. Yes, Sarah.
Hi, I was wondering, when you were presenting the data of people who get transported for alcohol abuse or any other substance abuse, like, how do you gather that data without violating HIPAA?
Sure. So those are collected by the state. There's a dashboard that you can look at from the state, and they de-aggregate that data. And I can provide that as a follow-up. So you could click on the state link. But she evaluated all public sources of data.
Okay, thank you.
Any other questions?
Did anything stick out to you? I know you've done this work with other towns. Was anything, do you think, unique or stood out that, would be a focus for us?
Yeah, I think again, like the idea that education alone will change what's happening when it comes to substance use, because I'd say that, for instance, we all know that we should not speed, right? We all know that we shouldn't drive over the speed limit. We've all been educated. We've all gone to, probably driver's ed or seen signs about how dangerous speeding is, but yet people still speed, right? And so it can't just be education. There has to be additional things that happen in a community to prevent and reduce substance use. But when the community was talked about, a lot of times they would say, just scare the health and tell the kids they're all gonna, get injured or die, like that will be enough, and that's not enough. And we know that increasing those protective factors, thinking of places where youth are gonna not use substances and having access to those places. We know that having great, strong policy in a community around substance use is really important, but there's many different best practices in addition to great education that need to happen in communities. So yeah, I think it didn't necessarily surprise me, but it just made me think like this is a really important for everybody on this call to know that education alone doesn't solve the problem. It has to be a collective approach across many different things. And I think helping people in the community to understand that there are great best practices that do exist, like Massachusetts really does have a lot of great resources when it comes to prevention coalitions and places like such to access like what are some best practices that are happening. Another thing that kind of did stand out to me was just the disconnect between services like harm reduction and just the perception that people had in the community of what those services are. A lot of people would say like, I don't think that we shouldn't have those, but just not in my community. And understanding what does that actually look like in a community? There's a disconnect, but what they think it looks like versus what it actually looks like. So I think that that'd be really important to educate the community around that stigma piece and what accessing help looks like. And lastly, I think a lot of times we don't hear people in communities talk about, that they're in recovery and what recovery actually looks like as well. So there's a lot of amazing people that, are in recovery, but don't necessarily share that with communities because of that stigma. So having more people say, like, look at this is what recovery actually looks like, enables more people to go ahead and seek treatment. So helping change that idea of what recovery actually looks like as well.
Yeah, thank you. And I feel like, something that we've learned throughout this substance use, writing the grant, like there are actually a good number of recovery centers in Westboro, there's one in Southborough. So I think we did reach out to them to include them in this data report, but really emphasizing that we do have services right here in our community that we can support and that residents do attend.
Absolutely. Any other questions or something that stood out that you'd like to know more about?
And anyone in the attendees, you can just raise your hand and Dana can send you over to our space if you have a question.
I think I'd want to point out too, just while people are waiting, like if you are in a community and you are interested in more of this work, or you want to know how to get involved and what you can do and any of those resources, I know Isabella will leave some contact information, and as well as being able to read the report. If anybody wants to kind of read the report, I strongly suggest anybody on this call read it. It has a lot of really great information as to things you could specifically do in your community to start talking through this as well.
Any other questions? Well, we have Amanda's fantastic brain. She lives this work.
And it does work. Prevention does work. I've seen it work in so many communities where they start a process of kind of uniting their resources together and creating a plan. It's really amazing to me. Yeah, Chelsea.
Thanks, Amanda, for the presentation. Sorry, I'm not on video. I have a unstable internet right now. But what do you think are the best next steps for the communities collectively and individually?
That's a great question, Chelsea. I think one, if your community does have some kind of prevention coalition, be a part of that discussion. Go to those places, have those discussions, because some of the best solutions for this work is it's definitely a collaborative approach instead of somebody doing this on their own. The second I would say is to read through the entire report. I think it's really helpful to kind of there's pieces in it that are very specific to each of your communities on here. So I think this was a broad general of the whole entire report, but reading those specific pieces for your community, I think is really helpful. And then I'd say doing what you can in your communities to just increase support for prevention initiatives and encouraging communities to talk more about this issue, because I think that's what reduces stigma long term, is when more communities and more people are talking about this.
Thank you.
Any other questions? So I will send out, it's a 40-page report, so I will send that out following this this meeting. If you have any feedback, I can let our consultants know. But yeah, this is really helpful, and I think our Greater Boroughs partnership is really a good place to, you know, communicate and collaborate with this work, and identify how to move forward. In whatever direction we do decide. And obviously knowing, you know, some of our towns are smaller, we get different money. So identifying those needs. But this was a huge first step of collecting data from the community. We wanted to hear from those in recovery, those working with those in recovery, living experience. So this was really a huge step. And we did it on a short time frame. So Amanda, and then April and Jen, who aren't on this call, we really do appreciate all of your work, and all of the people who did participate in this report. We thank you very, very much. All of the names are not included in the report, but we do appreciate, you know, we had voices from all 4 towns, which was awesome. And as Amanda said, all or most sectors that we look for.
Yeah, and I'd say, just in closing too, I will attach that question, Jennifer. I still don't have the answer to it just yet, but when we send this out to people, we'll attach the answer to that question as well.
All right, I'm just concerned that it might be skewed Westborough's numbers because it isn't just our residents. So I don't know how to have that addressed when this is released, you know?
Yeah. I definitely can make sure that whatever goes out when it's released, it includes the answer to that question.
Thank you. What were you gonna say, Isabel?
I was just gonna say, I was looking at, I was trying to find an answer quickly in this report too, and it does say, Westboro has the highest number of patients receiving community-based treatment services. So once you get that answer, Amanda, we could even call it out in the report before I send it to everyone, just so that's, you know, clear, so that it doesn't cause any.
Yeah, and I can ask our evaluator to edit that just to make sure that the final report that goes out just states that.
That would be perfect. So I'll hold off on sending that out until I hear from you and Jen.
Thank you so much.
Absolutely.
Any other questions? All right, well, we will just need to adjourn the meeting.
I move that we adjourn at 2:19.
I second.
Okay, all those in favor, Boylston?
Aye.
Southborough?
Aye.
Westboro?
Aye.
Northborough, aye. This meeting is adjourned. Thank you so much, Amanda, and thank you all for coming to like the 3rd meeting this week. I hope you have a great weekend, and feel free to reach out if you need anything. I will send out the report once I get that revised Westboro data point.
Thank you.
Thanks, everybody.
Bye, everyone. Thanks again.
Bye.
Bye.